services in the south from Monday. It's part of the radical overhaul of the way the NHS is structured and funded. So will we as patients notice any difference? And will you be one of thousands of volunteers who are needed to feed back your experiences of the NHS? Our reporter Emily Hudson's been looking into all these changes and joins me on the show this morning. So we've been saying the words PCT, primary care trust, it seems like for ages, but it's all change.
It is all change. From Monday, PCTs are no more, and CCGs, that's clinical commissioning groups, take over the budgets for the NHS in this area. You've got one in Dorset, one in the Isle of Wight, and then it gets a bit more complicated in Hampshire because you've got Southampton, Portsmouth, South Eastern Hampshire for Havant, Waterlooville, Petersfield, Fareham and Gosport, West Hampshire, that's Eastleigh, Winchester, Romsey sort of area, and then coastal West Sussex if you're over that far. Now, the idea of all this is the NHS is getting more expensive, it's costing more than inflation, and as we know, the government doesn't like spending lots of public money, and so we've got this problem where more and more people are needing the NHS as we have an ageing population. Everything's getting more expensive. We've got to make the NHS more efficient. I think most people agree with that. Of course, the NHS isn't means tested, it's free at the point of need, and the idea is to go back to the GPs, the frontline doctors who actually see patients all the time, and say, how are we going to sort this out? It's about keeping people out of hospital first and foremost. We talked a lot about that during our Destination Christchurch week last week, and the idea is that having people cared at home will actually cost us all a lot less, but it's also better for them. The other kind of side of it is the public health side of it. This role is now moving from being something the NHS do to being something local authorities and councils provide. So that's things like stopping smoking services, obesity services, sexual health services, and the idea is the government thinks that the people who look after housing and transport and leisure are actually best placed to kind of target that kind of areas. For the staff in the NHS, this has been a horrible, horrible reorganisation. I mean, they're so used to reorganisations of the NHS, but this one has been, if you like, the most radical in the last 65 years of the NHS. And a lot of them have told me that the attitude is keep calm, carry on, put your head down, keep going, and hope that I'm not one of those that gets, affected. So.
And just to clarify, all these CCGs are geographically based. They're not subject based, because I heard yesterday there was a suggestion that some
very
are
confusing,
doing...
because
right.
there are different chairs. There are chairs of each of these areas, but they're all geographically based in the sense that is their original briefing.
Right.
Some have leads for certain areas, so like, for example, the Christchurch CCG we met last week in Dorset. Some also have leads for certain subjects. So, for example, in West Hampshire, there is a feeling that child health is one of their priorities, so they have a GP who's primarily looking at child health right across the area, as well as having this sort of area that they're in. So it is very complicated the way it's done. And I mean, one thing that I wasn't sure about was for a hospital, let's say like QA in Portsmouth, that has sort of a catchment area of several CCGs, will this get complicated? Will one CCG be going, the priority is definitely this, and another CCG be saying, we don't know how these are going to pan out? So.
Well, let's ask our guest, shall we? Because we've got with us Dr. Nicola Cleeve, who's the Deputy Director of Public Health in Dorset, and also from HealthWatch Dorset, Chris Wakefield, in our Bournemouth International studio. And obviously in the last hour we were talking to the new chairman of the West Hampshire CCG. Nicola, first of all, good morning.
Good morning.
So just to answer that question that Emily was raising there, what happens if, for example, you're a hospital and your area takes in a whole load of CCGs as well? Would that be an issue?
Well, I think it could make commissioning complicated. I mean, I can really reflect on the Dorset position because obviously that's where I am, and I think we're in a very strong position because we're in the fortunate position of having a single CCG across Dorset. So formerly we've had two PCTs, but they have come together in a single CCG. So that means certainly for the hospitals located in Dorset, they only have to relate to one commissioning group.
I don't want to set one county off against another.
No, of course not.
But was that a conscious decision, and are there ups and downs of having smaller geographic areas or bigger areas?
Well, I think it is a balance, isn't it? Because there's obviously the advantages of localism in recognising the needs of the local population. But I think that the decision made locally was around something about economies of scale, and also recognising that there have been challenges in the past with two PCTs commissioning services across Dorset, and how actually having a single organisation might actually make that more easy.
Okay, bringing in Chris Wakefield from HealthWatch Dorset, who's also with us this morning. Morning, Chris.
Morning.
What's your take on this, and whether bigger is better for these new groups, or actually a more focused, smaller area has advantages? What do you think?
Well, it's all about, as far as HealthWatch is concerned, it's about people's voices. whether it be large or whether it be small, we as HealthWatch have still got the opportunity to challenge based upon the information that we receive from the local population.
And just tell me what your role is with this change. Are you a bit like a health Ofsted?
Similarly, we are basically helping you get the best out of your local health and social care. And it's really about, it's going to give children, young people and adults a powerful voice locally and nationally. We've got a seat on the health and wellbeing boards throughout the whole of the south of England, and different health watches have been commissioned differently within Dorset and Hampshire and so on and so forth. But it's really about getting everybody and anybody that is going to or has been involved with the NHS or the local authority to speak out about their particular circumstances and their experiences.
OK, to bring Dr Nicola Cleeve back in, Deputy Director of Public Health in Dorset. Nicola, there was some concern from MPs yesterday that it was unclear who'd deal with a big national health emergency if that happened, another bird flu, for example. Does this change with CCGs rather than PCTs and strategic health authorities?
Well, I think there are some other changes that you haven't mentioned, which is around the development of both the National Commissioning Board, which is a regional commissioning unit, which is commissioning some of the larger regional services that we have, and also Public Health England, which is obviously aligned to our local public health teams. And Public Health England has a very clear role in providing support around some of that health protection, those sort of big issues. And clearly, there is some lack of clarity around quite how the processes will work going forward, but I'm sure that will become clearer over the next few months. And I certainly think that there's a real willingness amongst staff to make sure that we're flexible, to make sure that things do work in the future.
Final thought, is there a danger that public health will now be subject to the same financial pressures as other council services, Nicola?
Well, I can only reflect the position in Dorset, and certainly we've had tremendous support from the 3 local authorities here. We're forming a single public health team across the whole of Dorset. Public health funding is ring-fenced, certainly for the next couple of years, and what that means is that local authorities can only spend it on public health services. So certainly for the next couple of years, we feel very confident that we'll be able to continue to provide exactly the same services and hopefully better services than we have done historically.
OK, thank you. And Chris, very quickly, I know you're looking for thousands of volunteers to get involved, aren't you?
Well, my aim in Dorset is to get at least 5,000 volunteers speaking about HealthWatch, gathering people's views, feeding that back to Dorset HealthWatch, and then all of those views we can feed up to HealthWatch England, because there is a national body as well.
Right. So is it the website healthwatch.co.uk?
Well, it's in the middle of being built, because we don't launch until the 1st of April.
All right.
But what I would suggest to everybody...
Well, I hope you get it ready by Monday.
It will be ready by Monday. There's somebody working on it at the moment.
All right.
Is that they Google HealthWatch and put their locality in so that they can engage with a HealthWatch in their area and get their voices heard.
Chris, thank you very much for that. Dr Nicola Cleeve, thank you. Emily Hudson, thank you as well. 14 minutes past 8. Well,